Signing up for Medicare is a big decision and must be done at the right time. In this video, I'm going to explain the different times in which you can sign up for Medicare to be sure that you're doing it correctly. Now, the first thing that we have to consider is it time to go on Medicare? And so the answer to that question revolves really around your particular situation, because there are 5 different groups of people that have to go on Medicare at 65. And so I want to be very clear, if you're in one of these groups, when it is you're going to go on Medicare. Okay, so if right now you're covered by some kind of a retiree insurance, this could be a retiree plan of you or your spouses, but that's your coverage right now. You have to start Medicare at 65. If you're covered by COBRA insurance, again, you have to start at 65. If you're covered by some type of an Affordable Care Act plan, meaning you went through the healthcare exchange to set up an individual plan, again, you're going to drop that plan and you're going to go on Medicare at 65. If you're covered by some type of a group plan right now, meaning you or your spouse is still working, you have a group plan, and this group plan has 19 or fewer people on the payroll, then you again are going to have to start Medicare at 65. If you have a group larger than that, you don't have to, but if it's 19 or less on the payroll, you're going to have to go on Medicare at 65. And then lastly, if you're on what is called TRICARE, this means that you were served our country in the military and you retired from the military after 20, 25, 30 years, you have TRICARE. And once you are Medicare eligible, you've got to start Medicare at 65, and that insurance actually becomes TRICARE for life. And so my point is this: these 5 groups of people have to go on Medicare at 65. You have no option whatsoever other than to go on Medicare. And so here's what's going to happen. If you're already receiving a Social Security benefit, you're going to be automatically enrolled into Medicare. And you're going to receive your Medicare card in the mail. It'll come directly to you. That red, white, and blue A and B card will be mailed to you about 100 days prior to your 65th birth month. Okay, 3 months and a couple weeks prior, it's going to come to you. Now, if you're not on Social Security, then you are going to have to self-enroll. Okay, and that self-enrollment process, I'll tell you about that here in just a minute. But there's 2 types of ways we get enrolled into Medicare: either automatically enroll because we're on Social Security. If we're not, then we have to initiate that enrollment. So let me explain the enrollment period at 65.
Hey, my name's Josh Musick. My dad, Marvin Musick, who's doing this video, would really appreciate it if you would like, comment, and subscribe to the video. What that does is it helps YouTube know this content's valuable, this video is helpful, and it pushes out to other people who really need to see it. So go ahead, like, comment, and subscribe, and you can get back to watching your video.
So for those of you that are going to start Medicare at 65, because you're required to in those scenarios, you're actually going to come into Medicare using what is called the initial enrollment period. Initial enrollment period. Now, keep in mind, not everyone is going to start Medicare at 65. The people that are not going to are folks that are actually covered by an employer group plan that has 20 people or more on the payroll. All right, meaning you're working, your spouse is working, and you have insurance through that employer-provided plan. Folks, you don't have to do anything with Medicare A or B. Now, I know you'll hear people say you've got to take A and if you're going to keep working, and that's not true. Okay, you'll not be penalized. You can pick up A at a later date. You certainly don't want to take A if you're covered by a group plan that also includes a health savings account, an HSA, not an HRA, not a flexible spending account, but an HSA. If you take Part A, you can no longer contribute to your HSA. So I would stay on the group plan and continue to contribute to your HSA. I think that's a very smart choice. But if you do have a group plan, you or your spouse is 20 or more, and that plan is better than your Medicare option, then you don't have to take Medicare at 65. You actually will come in later using what we call the special enrollment period. I'll explain the process of that, okay? But now we're going to deal with this initial enrollment period for people that are going to come into Medicare at 65. What's the process that you're going to follow to do that? Okay, the main thing to get with this initial enrollment period is the timing, okay? And so what I'm going to do, I'm just going to treat this as though someone, let's say their birthday is 4/15/1958. Okay, 4/15/1958, and they are going to turn 65, and they're in one of those 5 groups: retiree insurance, COBRA insurance, ACA plan, group plan 19 or less, or covered by TRICARE. You're going on Medicare. And so your A and B effective dates would be 4/1/2023. Okay, and so you're coming in during your initial enrollment period. Now remember, if you're on Social Security, they're going to automatically enroll you, and they're using the initial enrollment period. But if you're not on Social Security, you're going to have to self-enroll, and this initial enrollment period, folks, lasts for only 7 months. 7 months, and that's it. And those 7 months are your birth month, which is April in my example, and then 3 months before, and then 3 months after. Okay, so here's the way that would work. All right, so we have to enroll during these 7 months. And so if we need to start our Medicare April 1, the smartest thing to do is to enroll sometime in January, February, or March, because the result of that will be an effective date of 4/1. Now, if someone doesn't enroll those first 3 months to start April 1, what will happen if you did the Medicare enrollment in the month of April, they're going to start you in May. If you enroll in May, they're going to start you in June. If you enroll in June, they're going to start you in July. And then if you put it off to the very last month, what's going to happen? You can still do so, enroll in July, and they'll start you in August. But again, if you need insurance, you ought to do it in advance so it starts exactly when you want it to on your birth month. That is called the initial enrollment period. Now, the process for doing this, folks, is this. The first thing you want to do is you want to have a myssa.gov account, myssa.gov account. Okay, you can set that up. It's going to take you about 15 or 20 minutes. And just keep in mind, if you decide to use our company, we're happy to do this with you and for you to make sure this is done properly. But once we have a myssa.gov account, the critical thing is you'll have to establish a username and a password and get everything set up. Don't lose that username and password, okay? And once we have that, then we actually can go online and we can enroll into Medicare A and B. And we can do all this online through the Social Security website. Okay, and you can do a Medicare A-only application. Now, if you want to start Social Security at the same time, you can also add that to the application, because what will happen when you're applying, they'll ask you, are you wanting Medicare only? And if you say yes to that, then it'll pre-fill a Medicare only application. If you say you also want retirement benefits, then you can tie the 2 applications together. Okay, and so this process can be done online. In fact, if you need some assistance with it, we certainly can do that with you and for you as well. Okay, so that is called the initial enrollment period, and you must enroll using initial enrollment period at 65 in those 5 different scenarios. All right, now let's talk about those of you that are not going to start Medicare at 65. You're actually going to come in at a later date. So this is someone, let's say they're waiting on their Social Security, and so they're going to keep working, and then they're going to wait till they get to the full retirement age, or whatever reason they're going to not take Medicare 65, but they or their spouse are going to keep working, going to be covered by a group plan. So in this scenario, what we're going to do is we're going to be using what is called the special enrollment period. Okay. Now, this special enrollment period is for those that didn't go on Medicare at 65 because they had a group plan. And so what happens here is the special enrollment period is a different process. Again, it is still good to have a myssa.gov account, right? And then what we're going to do is we can go ahead and we can go online and we can apply. But typically in this kind of a scenario, what we're going to do is we're going to apply for A only to make sure that we're in the system. And then what we're going to do to get B is we're going to add B by 2 forms. We're going to use what is called an L564, and we're going to do it what's called a 40B. Because if I come in using the special enrollment period, what I have to do is I have to prove to Medicare through the local Social Security office that you have had credible coverage back to 65. So let's just give the scenario of someone that's going to work until they're 68. And what we have to do is we have to prove they've had credible coverage back to 65. Now, you may have been with an employer plan for 40 years, but we care about going back to 65. So we're going to use the L56 form to prove this. So we have to go back 3 years, and we'll fill out Part A of the form, which is your name and Social Security number. And if your spouse is also going to be making this transition to Medicare, we have to have one L564 for both of you. And so we're going to go back, and the HR department at your work, or somebody that has the employment records, will be the one that will fill this form out. And they're going to verify you've had this credible insurance at work, that someone was working, and when that coverage began and when it's going to end. And so the L564 then, once it's filled out, will be submitted by you, or if you work with us, we'll guide you through this process. But that L564 will go into the local Social Security office along with what is called the 40B form. Now, the 40B form is, again, a very simple form, but what it does, it lets Medicare know when we want to start our Medicare benefits. Okay, so let's say that we're working and we're going to work until March 31 of 2023, and then we're ready to start our Medicare 4/1. We would actually put on the 40B form, please begin my Medicare 4/1 of 2023. So this form is for the purpose of letting them know when we want to start our Medicare. So the L564 proves that we can come into Medicare with no penalties or no problems. We're eligible for an SEP. And then the 40B tells them when we want to start our coverage. Now, one thing that's critical, folks, is we never submit this paperwork any sooner than 90 days before we want our Medicare to begin. Because if you want your Medicare, you do this paperwork and you want it to begin in 5 or 6 months, they will not process that application. It's done too far in advance. So within that 90-day window, people ask me all the time, Marvin, when should we call you? Somewhere between 60 to 90 days before you're going to lose the group plan is when you get this paperwork completed and then get submitted to the local Social Security office. Okay, so that is using the SEP. And who gets to use this? Anyone who was covered by they or their spouse's employer-provided plan that had 20 or more people that were on the payroll. That's considered to be a large group by Medicare. You're eligible for an SEP. And the way to do this is just 2 to 3 months in advance of losing your group plan. That way we move off the group plan. In my example, March 31, we make a very smooth transition into Medicare April the 1st using the special enrollment period. If it's time for you to go on Medicare or switch a plan, it would be our privilege to help you. Our services are totally free to you. We are independent brokers, which means we are truly unbiased in the information that we share with you. If you'll reach out to us through our website, MedicareSchool.com, you can schedule an appointment. We're in the pinned comment below, and then you can always call into our office as well, 7 a.m. to 7 p.m. Central Time, and you will be assigned a guide, a Medicare guide, which is our agent, and they will walk you through the entire process. We can help you with your SSA.gov account, help you enroll into Medicare A and B, help you with Social Security if you would like that as well. Anything that anything that you need, we can help you with, truly A to Z. And the great thing is our services are totally free to you. The insurance companies always pay the agent, so we come at no cost to you. And we have a wonderful customer support team as well. It'd be our privilege to help you. Reach out to us if you'd like some help. Thanks. Now, this last enrollment period that I'm going to talk to you about is one I'm going to tell you about, but I only want you to use it. And the reason for this one is because this one has problems and penalties. This is called the GEP, or actually called the General Enrollment Period. So here's the way the General Enrollment Period works. And again, why would someone use this one? Because they didn't use the IEP, and they didn't use the SEP. Maybe they missed these. So these are no longer eligible for them, and now they're stuck with the GEP. So here's the problems with the GEP. We can only enroll into Medicare using the GEP January 1 to March 31st, okay? And so that's it. So if I find out I made a mistake in May or June or sometime other than this, then I'm going to have to wait till the next year to enroll in Medicare. And so when I enroll in this GEP, the first quarter of the year, if I enroll in January, my Medicare will start in February. If I enroll in February, my Medicare is going to start in March. If I enroll in March, again, you can see what's happening. My Medicare is going to begin in April. Okay, so I enroll and they start me the next month. But again, if I realize I made a mistake beyond March 31, I can't do anything about it this year. I'll have to wait to the following year. Now, the second problem with this general enrollment period is that for every 12 months I went without Medicare B when I should have had it, there's a 10% penalty added to my Medicare premium, and that penalty is a lifetime penalty. And folks, that's why we want to either enroll in the IEP or the SEP following that process, because we don't want to have these lifetime enrollment penalties. Okay, so it's either initial enrollment period, if I have to start at 65. If I'm not starting at 65 because I'm covered by a group plan, I use the special enrollment period. And then if I happen to make a mistake, I still have this GEP available, but it comes with penalties and a limited enrollment period. All right, now, once we've made the decision to enroll into Medicare, I just want to highlight a couple things. You are going to probably want some additional insurance. And again, I'm just going to give you a quick summary. I've done lots of videos on this and other places you can watch, but here's what it boils down to, folks. The first thing you have to do is you're going to have to be enrolled into A and B. A, for most people, has a zero premium. B, this year cost $170.10 a month. Okay, so A is free, B cost. That B premium is taken out of your Social Security check if you're receiving benefits, and if you're not, they'll bill you for this quarterly, or you can set up some type of electronic payment with the government to pay that until you start taking your Social Security. But everyone has to pay for Part B. So once we've enrolled in A and B, basically here's what happens. We have two different insurance options available to us. We can get a supplemental plan and add a drug plan to that, or we can get a Medicare Advantage plan that includes a prescription drug plan. Those are your two options. And these two options have only one thing in common, and that is we've got to be enrolled in A and B. We got to pay our premium. But beyond that, these two systems are totally different. And again, I'm just going to highlight the differences so you'll know that once you go on Medicare, you'll see what your options are going to look like. First off, what happens is if you take a supplemental plan, your out-of-pocket expenses are minimal other than premium. We got to pay a premium to the supplemental company because they are going to cover the gaps that Medicare did not cover. So out of pocket will be the premium, and most people right now are out of pocket just a small, what's called the B deductible. B deductible. This year, that's $233 once a year. So I pay a monthly premium for my plan that I get, and then after that, I'm pretty well done other than maybe a small deductible. On my Medicare Advantage plan, there's no premiums for them other than I got to pay Medicare B. But the reason there's no premium is because what I'm going to do now is I'm going to pay copays, I'm going to pay coinsurance up to a max out of pocket, called max out of pocket. Right now, that ranges anywhere from about $3,500 to about $10,000 a year. So a lot of times people see these ads on Advantage plans, and they talk about a few of the zeros that a person has as though there's no cost to the Advantage, and that's not true. There's always a cost. You'll go to the hospital, it's going to cost you $350 a day. You see a specialist, probably $50 for a specialist visit. Outpatient procedure, surgery, probably $250 to $300. Have a CAT scan or an MRI, probably $250. But we pay as we go in the Medicare Advantage system. Over here on the supplemental side, we pay a premium, so we don't pay as we go because we pay the premium, and we're pretty well done other than a small deductible. So those are the two different systems. You have to decide what you're most comfortable with. Now, another difference between these two systems, very critical, and that's this. You are going to have insurance, and these insurance plans are going to work differently. And what I mean by that is the features of these plans are different. You're going to find that with supplemental plans, you don't have any perks. Okay, you don't see a lot of companies with supplemental plans that offer gym membership and a dental benefit and those kinds of things. These over here have lots of perks. And this is what you'll see on the ads, right? Lots of perks. They'll throw in a little dental benefit, a vision benefit, hearing aids, sometimes a gym membership, over-the-counter card for over-the-counter items once a quarter, and maybe even a Part B reduction. But this side over here of the equation are where you'll see all the perks, all right? Now, but what they don't tell you, though, is beyond the perks, how the insurance is going to work. And this is really where these two systems are going to vary drastically. Number one, when we have a supplemental plan, we have no networks. You can actually go to any doctor, any hospital that takes Medicare. They will take your supplemental plan of choice. They have to, okay? Over here, you're going to have HMOs and PPOs. So now we've got networks of doctors and hospitals. Not everyone takes Advantage plans. There's going to be restrictions and limitations. Sometimes you got to stay in your network. PPOs let you go out, but it costs you more to go out of network. But again, that's the difference between these two options. You have to decide, do I want to network or not? Do I want to go anywhere that takes Medicare, or am I fine with some limitations? Secondly, and this is a big deal, when it comes to supplemental plans, you have no pre-authorizations. Okay, over here, about 70% of the services are going to have to be pre-authorized, which means the insurance company on the Advantage side has the final say-so. Pre-authorization means you need a CAT scan, an MRI, maybe a skilled nursing stay, maybe an outpatient procedure, cataract surgery, knee replacement, hip replacement. All of those items are going to have to be pre-approved by the Advantage company. And if they agree that you need it, you'll get it. But if they don't agree, you're not going to get that. Had a lady just last week that needed a knee replacement. Advantage plan did not agree with that decision and said, no, we're not going to pay for it. And that's exactly what happens. And so there are times when they may agree, sometimes they may disagree, but they do have the final say-so with the Advantage plan. If you get a supplemental plan, there's no pre-authorizations. If the doctor says you need it and Medicare says it's covered, the insurance company has no say-so whatsoever. Medicare pays, they pay. Medicare doesn't, they won't. But if Medicare does pay, they will follow based upon the supplemental plan that you purchased. Again, so no pre-authorization. And then lastly, and I'll conclude this, and that has to do with the permanency of the policy. When it comes to supplemental plans, they are permanent. They truly are for life. All you have to do is pay your premium, and you never have to worry about losing that plan. You actually can, let's say you live in Denver, Colorado, and you move to San Francisco, take it with you. Or you live in Kansas City, Missouri, where I'm videoing today, and you decide to move to Miami, take it with you, because supplemental plans are the same coverage anywhere in the country, and those are totally portable policies. They can never be canceled because you've relocated. They cannot be canceled because of your age. They can't be canceled because you have a lot of claims. As long as you pay the premium, they're going to have to keep covering you on your health care services. Not so when it comes to Advantage plans. Advantage plans are one contract year, and that's it. The plan may be around next year. It may not be, but they can come and go. Doctors change networks, and things can change because they're only a one-year contract. They're not portable. So if you live in Denver, Colorado, you move to San Francisco, you're not taking your Advantage plan with you. It can't go there. It's a different service area, so you have to get a new plan whenever you move. They're not portable. Okay, and then lastly, when it comes to these plans, when you get a supplemental plan, you have a 12-month window. There's no underwriting required. These are supplemental plans. So 6 months before you start your Medicare and then 6 months after you start your Medicare Part B, there's no underwriting involved. The insurance company has to write your policy, whatever you want. They will issue it. We call it guaranteed issue. You never have to worry about them denying that coverage. They will approve the policy. That's 6 months before you start Medicare, you can apply, and then 6 months after, you're still in that window where you can get anything that you want. But after that, in most states, if you ever want to get a new supplemental plan, a different one, a different letter, or a different company, now you got to medically qualify to make that move. Okay, so that's underwriting when it comes to supplemental plans. Now, when it comes to Advantage plan, there's never underwriting. If that Advantage plan is in your service area, your metro area, and you like the plan, the features of the plan, the network and all that, you can enroll in the plan, no health questions asked. But here's what happens. If you stay on an Advantage plan more than a year, let's say you're on that plan 2 to 5 years plus, and you would like to get off the Advantage and move back over here into the supplemental world, and you get a supplemental plan, now you have to medically qualify for sure. We're going to have to ask you 25 to 30 health questions, check your medications to see what you're being treated for. And as long as the underwriter agrees that your health is not too bad, they may approve that case, and now you can get a supplemental plan. But if you have anything going on and with your health, rheumatoid arthritis, spinal stenosis, AFib in your records, certain opioids, just certain health conditions and medications, where if that insurance company does not like your pre-existing conditions, they do not have to take you. And so you may have to stay in that Advantage plan then for the rest of your life if you cannot get medically underwritten to be able to make that switch. All right. And so it all boils down to these two systems, and you simply have to decide what's best for you. There is no right or wrong, good or better, nothing like that. It just simply the two choices, and you have to decide what's going to be best for your situation and best for your budget. All right. So those are the plans that are available to you. And so we want to make sure that you don't make any mistakes. Don't miss the opportunity to be able to enroll into that supplemental plan when there's no underwriting. And if you decide Advantage plan is best for you, be sure that you've done your due diligence to make sure you're comfortable with the networks, the co-pays, the max out of pocket as well. All right. Thanks so much for watching.